Good afternoon, guys. Welcome to the third episode of the Dog Bolozi podcast. My name is Blessing Jodzi, but I'm better known as Dog Bolozi on all my socials. Yeah, if you want to find me, you can find me on Facebook. Look for my normal account, Blessing Jodzi, right? You find it there. I post medical stuff there every day. Or just find me on my page, Dog Bolozi, right? DOCBULOZI. Yeah. And surname Jodzi, NJODZI. You can also find me on my Instagram, right? My username is DOC underscore BULOZI, Dog Bolozi. Also the same on my TikTok, DOC underscore BULOZI. I post every day there medical advice, and leave a like, leave a comment if you like it. If you like it, follow me, subscribe to my work. Yeah, support my grind. So currently I'm located at Mpilo Hospital in a city called Blawayo in the country of Zimbabwe. And currently I'm doing orientation. It means I learned outside. And now that I'm back, I do have to do 6 months where I'm orientated on how things work in Zimbabwe. So yeah, today's episode number 3, we'll be talking about cervical cerclage. Cervical cerclage is a procedure where they do a suture, right, on your cervix during pregnancy. On your cervix, they tie it so that it's closed, meaning it's already open, and it shouldn't be open during pregnancy, right? It's a weakness in the cervix, a cervical weakness, and most of the times there's no cause really, or yeah, sometimes there are things we can call risk factors, meaning things which, if you have, make you more likely to have that cervical weakness, or that your cervix is open when it should be closed during pregnancy, right? They're risk factors. But most of the time, it's idiopathic, right? It just happens. So if we were to put it into definitions terms, maybe for some medical people watching, right? I would say cervical cerclage is a supportive suture in the cervical vaginal junction to prevent early pregnancy loss or preterm, right? So cervical vaginal junction is the junction where your cervix, right, and your vagina meet. At that junction, that's where they put the suture. And also it prevents early pregnancy loss. That means usually babies are lost in the second trimester, right? That means the pregnancy is split into three periods, right? The first, third, second, third, the third. So in the second third, usually that's when we lose people. That's when you lose a baby if you have a cervix weakness, right? Or it also results in preterm babies. Preterm means they're born before their time. Usually in pregnancy, right, we expect the child to be born from somewhere from 40 to 42 weeks. That's the usual. Oh, depends with places, but yeah. More than 37 weeks, 38, 39, 40 is sort of normal, but less than 37 is called preterm. Yeah, so that can also happen. So risk factors, right? Things that can make you more likely to have a weak cervix, or a cervix that's open when it should be closed during pregnancy. Number 1, if you have a previous history of losing your child during pregnancy, in the middle part of pregnancy, or having preterm babies, if it's been there. Usually, if it's happened at least 2 times, losing your baby in the middle of the pregnancy, or more than 3 preterm babies, there is a highly likelihood that you have a weak cervix and you should get a cervical cerclage. Number 2 is a previous obstetric or gynecological trauma. Obstetric just means something related to ladies who are pregnant, right? Or gynecological, meaning it's related to women. So you could have had a rapid delivery which damaged your cervix, right? It was too fast. That can happen. Maybe you had multiple gestations, meaning you had more than one baby. Also, cervical conization. That means part of your cervix was removed, right? Sometimes it happens that when you do a procedure where they check if there's any kind of cancer or anything happened to your cervix, if it's there, sometimes the part affected is small, so they remove it so that that cancer or that pre-cancer stage does not go to other places. So it's called conization. So when you have that and it's removed and you have a baby, you have a weak cervix because part of it has been removed. So that can be one of the reasons why you should get cervical cerclage. And also termination of pregnancy can be a risk factor. Number 3 is a short cervical length. That means your cervix is short, right? Usually less than 2.5 centimeters on ultrasound before 24 weeks. of pregnancy, right? So if they see that your cervix is short, it's less than 2.5 centimeters on ultrasound before 24 weeks of pregnancy, you're more likely to have cervical insufficiency, right? That's the medical term for this cervical weakness. But I'll just call it cervical weakness for the sake of understanding, right? Then we go to number 4. We have connective tissue weakness, right? Connective tissue just means tissue in the body, right? So your muscle, no, not muscle, no. Connective tissue is just a type of tissue found in your body, right? So the cervix is made up of is made up of connective tissue. It's what joins things together. It's what keeps things together, right? So if the connective tissue, which is found in most of your body, really, almost everywhere, collagen, if you know of it, right? Because some of you ladies, you buy products with collagen and so on, probably you've heard the term connective tissue keeps things together. So when you have problems with the connective tissue in your body, which holds structures together, it can result in a weak cervix. Then also we can have exposure to something called diethylstilbestrol. Diethylstilbestrol. It was a drug made in the States, 1938 to 1971. So probably if you're exposed to it, right, you probably have a weak cervix. It's a risk factor that you could have a weak cervix because this drug was considered unsafe and stopped. Okay, so how can you identify that you have a weak cervix, right? The topic hasn't shifted from cervical cerclage to cervical weakness, because usually the main purpose of doing a cervical cerclage is because you have a weak cervix. So I cannot talk about cervical cerclage without talking about a weak cervix. So features, right? What usually happens? Usually there are no symptoms until you're pregnant. Usually, you lose a baby in the second part of your pregnancy, right? Or you usually have babies born before 37 weeks. That can be highly suspicious. So most of the time there are no symptoms, but that can happen. Also, we have something called non-specific symptoms, meaning it's not too specific to a weak cervix, but it can happen, right? So you can have pelvic pains or a backache, right? You can have an increase in the volume of your vaginal discharge, right? Usually have a discharge, right? But the discharge amount increases. You can see it might be blood stained, right? With spotting. It could be yellow, or it has a thinner consistency, right? And also you can feel some kind of vaginal pressure. So those things can actually happen. Can be signs that you have a weak cervix and you need cervical cerclage when you get pregnant. All right. Then we move on to the real cervical cerclage thing, right? So we have three types, basically. Three types, which I found when I researched, right? We have something called the McDonald cerclage, we have something called the Cervical cerclage, and something called the transabdominal cerclage. I'm not too well vexed in these ones since it's more of a surgeon thing, but I did research, and the two main ones I found were McDonald's and Cervical. So McDonald's, right? So basically they're suturing your cervix. Yeah, you get that part. So with the McDonald's one, it can be removed by 36 to 37 weeks, right? So that you can have normal delivery. So with this one can be removed, right? So they put it before 24 weeks. It should be put actually from 13 weeks to 16 weeks. That's when the cervical cerclage should be put. It's not recommended to put it after 24 weeks, right? Because it could cause certain problems. So the McDonald one can be removed by 36 to 37 weeks. Even in a normal office setting, it can be removed, right? And then would be expecting you to have a normal spontaneous labor, meaning you just get into labor. Then we have the Cervical. That one is permanent, meaning you give birth by C-section, right? Yeah. And those ones should be put less than 24 weeks. Actually, both of them should ideally should be put from 13 weeks to 16 weeks, but overall should be put less than 24 weeks, right? And it's not really recommended for people who have more than one baby, right? Meaning you have twins or more. It's not really recommended, but it can also be done. It can be done. That becomes a personal decision, both to the doctor and to the patient. The patient is told what could happen, the likelihood of things going wrong and so on, but it can be done. And I actually had someone, comment that they had the cervical cerclage with a twin on one of my pages, right? And I was like, wow, yeah, medicine is good. Then lastly, reasons you might not get the cervical cerclage even if you need it, right? Even if you have a weak cervix. One of the reasons you might not get it: one, you're in preterm labor already. That means you've already started labor and it's less than 37 weeks. That might be a reason you do not get cervical cerclage. Number two, premature rupture of membranes, right? The baby is contained in a membrane, right? Where the baby floats and swims, they're protected. But if that membrane ruptures, they can't put the cervical cerclage anymore because probably you're now going into labor. Number three, if you are more than 24 weeks gestation, meaning you're more than 24 weeks into your pregnancy, which is basically 6 months, more than 6 months, it's not recommended for you to get a cervical cerclage. Then number four, unexplained vaginal bleeding. In that case, it's not recommended to get a cervical cerclage. Also, if you have chorioamnionitis, that's just a fancy term for saying that the membranes or the structures surrounding the baby, right, are inflamed, meaning they have some sort of infection. In that case, you cannot get a cervical cerclage. Or if you have a vaginal infection also, you cannot get a cervical cerclage. So yeah, that's what I have for you today. It's short, 11 minutes 30 seconds. So I hope you join me next time on episode 4. Hopefully I will invite someone over, someone I learned with in Russia, but he was in Moscow. So either the next episode or the episode after this one, we'll have that guy over. So yeah, Doc Molozi bringing you information. Peace.